Hi, I'm EJ Schleifer with Butterfly Battles and Articulate, and I am going to go over the basics of the Chapter 1 in the Dialectical Behaviour Therapy workbook. First, I'll say that in the book it explains that DBT sees, frames pain um, as unavoidable and unpredictable. So pain and suffering. So basically, this framework acknowledges that in our lives, we're going to have pain, we're going to have suffering, and we can't prevent all of it. As long as we're alive, it's going to be happening, and we can't avoid all of it. And it's going to be a surprise sometimes. Some people, when we experience discomfort, especially extreme discomfort, we have overwhelming emotions. And when we get overwhelmed with our emotions, then we tend to make decisions that are maybe not so great. So, DBT is a technique of teaching ourselves to choose differently. DBT also practices radical acceptance. So, radical acceptance isn't saying that everything that happened is good and we're going to find the good in it, or I approve of everything that happened. Radical acceptance is merely seeing things the way that they are and accepting that the way they are is the way they are. Radical acceptance is not resisting what the current situation is. So, radical acceptance is about accepting our emotions and the emotions of others as the fact that, yes, this is the emotion I'm having. It's not necessarily saying that this was the right choice or the best choice, rather, the most effective choice. Okay, so chapter 1 talks about 2 distress tolerance skills. 1, distraction, and 2, self-soothing. When something happens that's upsetting, we can distract ourselves so that we can perhaps choose an action that's different from what we normally choose. So when we distract ourselves, it's not about avoiding it so that we never deal with it, because DBT says part of radical acceptance is saying that this thing happened and I need to deal with it. However, when we're emotionally overwhelmed, now is maybe not the right time. So, distraction is a chance for us to step out from that emotional overwhelm a bit. So, there are some things, some suggestions, and you can just kind of maybe think about what works for you, or maybe think of something that I don't say. And of course, there's other examples in the book. But um, some examples of how we can distract ourselves are, we can do harm reduction, we can do something pleasurable, we can focus on someone else, we can take the attention off ourselves, we can think of someone that we care about, and those are the basic, those are the, well, sorry, there's a few more. Oh no, that's it for distraction. Okay. Oh, then it's distracting thoughts. Oh, we can leave the situation. We can do a task or a chore. We can count. Okay, so these are all sort of techniques. Let me just give an example of each of these, just to kind of give you an idea. So harm reduction is something like, instead of doing something that's self-harming, we do something that gives us that physical sensation, a strong physical sensation, but doesn't lead to permanent damage. So, for example, we can distract ourselves by holding tightly with one hand an ice cube. Pleasurable things, for example, we could talk to a friend, we could look at the clouds, we could focus on someone else by asking a friend if they need help. We could take the attention off of ourselves. We could people watch. We could count the buttons on people's clothing. We could count the cars that pass by. We could think of someone that we care about. We could keep a picture in our wallet of a friend or a family member, someone who is maybe passed. And when we're upset, we could take it out and have an imaginary chat with them. that might help us. So we can also distract ourselves by leaving the situation, physically leaving it. We could do a chore or a task. We could, fold something that needs folding, do the dishes. We could count our breaths, count by 7. This is something that will distract us. So the workbook is really focused on giving us tools for us to actually use. So at this point in the workbook, it suggests that we actually take a piece of paper and write down some distractions that might work for us. Okay, so DBT has this acronym called REST. So rest is something that we can do. This makes sense. Rest is something that we can do when we're emotionally overwhelmed. So first is R, relax. We can stop. We can take a breath. We can pause. We can, as I said, leave the situation, just step away from the situation for a moment. Then we can evaluate, like I said, radical acceptance, kind of say, okay, what am I feeling? What is the other person feeling? What has happened? This evaluate is not about judging. It's not about, I did the wrong thing, they did the wrong thing. It's just about acknowledging what has happened and taking a look at it after we've relaxed a bit. Then S, set an intention. So this is a specific goal or coping skill. And this intention that we set, that we choose, it doesn't need to solve the situation all by itself. We actually might rest a few times for the same situation. This is just about choosing a goal that will meet our needs and our needs for our relationships with other people and that aren't going to be harmful. So perhaps different from what we've been doing before. And then T is take action. So this is taking a calm and hopefully effective action, because sometimes when we're emotionally upset, even if we make maybe a good choice or we have an idea of what we want to do, it's difficult to sometimes follow through with it effectively because we're in this emotional arousal. So, so it's suggested that we kind of take this paper that we have our distractions listed on and write out the REST acronym. And, maybe you could also write down a few things that might help you rest. So maybe taking a breath sounds more appealing to you. Maybe it's easier for you to evaluate if you step away. Maybe it's better for you to evaluate after you've actually physically left the space a little bit. So these are some good things to think about. It's suggested that actually we sit down and we kind of think like, oh, when might I need to rest? Next week. I'm about to, go to a family gathering. Might I need to rest? REST at some point? Has it happened before? So anticipate and identify some times where this skill might be needed. Okay, so the other thing that's talked about in chapter 1 is self-soothing. So how do we relax? How can we relax when we're so upset? Well, think about what might be soothing for you. We can think about it in terms of our 5 senses. Maybe sense of smell. We can burn scented candles. We could bake some food with a pleasing smell. For our sense of vision, we could look at art. I like to sometimes flip through the galleries of juxtapose or high fructose. For hearing, we could listen to soothing music, of course, maybe like a calm podcast, maybe not a political podcast, although I do like to listen to podcasts about the history of anarchism. I find that calming. Well, not about events, but about the theory. Our sense of taste. Now, this one, if you do have an eating disorder, this might be maybe not a great choice, or just maybe something that you might want to give a little bit more thought of how to do in a way that won't be triggering. And then sense of touch, take a cold or a hot shower, give a self-massage. And so again, it's a great idea to actually add 10 things that we find self-soothing to this paper where we have the REST acronym, some options for distracting ourselves that will work for us. What I write down might be different from what you write down, and that's fine. And finally, we are valuable people who deserve to have joyful and peaceful lives. So you know what? Self-soothe more often. That sounds like a wonderful idea. DBT is not just about addressing terrible situations. DBT is kind of a pathway, a step progression towards being a better person, growing so that we can be happier and so that we can be more satisfied with our relationships with other people. Thank you.